GMH, through grant funding from the U.S. Department of Interior, will be funding a full-scale, accurate diagnostic of the facility by the Army Corps of Engineers to determine the integrity of the structure. Before the assessment can begin, hospital officials are gathering all the information and data for the Corps to give them a full understanding of the scope of work their assessment will require. Administrator Lillian Posadas explains.
Hopefully that in a month, or sooner, because we'd like to get this going and have a determination whether or not we can proceed with the family birthing center or any modernization or any upgrades for the facility. Primarily, I like to also just emphasize the electrical panel. That is something that I'm just really concerned because I don't want to have an explosion to deal with.
Posadas says there was a fire that broke out last year in the radiology division due to a short circuit. The electrical panel has been an issue since the early 1990s, according to a document provided to us by Senator Moylan, who is proposing a bill to appropriate $6 million to GMH for the replacement and upgrade of the electrical system. Another critical concern of the administrator is their comprehensive electronic health recording system.
That's the online, the computerized documentation that the physicians and every entity of this hospital utilizes to enter information on the patient, diagnosis, laboratory works, radiology, pharmacy, the medications that need to be, administered.
The system is called Optimum, and the company currently servicing the system is Contata, who will be sunsetting the program, which means they will no longer provide support for the system should any issues arise. When the problems rain, it pours as employees, patients, and visitors walk through the hospital's main entrance, greeted by signs of leak and flood mitigation efforts carried out by GMH staff. Old tattered linen that the hospital stores is used to line areas where leaks pool up and can cause even more damage.
So this is just a regular downpour. Every day we have to soak up the water. We send our crew to use a wet vac to pull up the water so we don't ruin our flooring. You can see the damaged ceiling tiles. This happens every day that it rains because our roof needs to be replaced. We've got cracks on the roof that need to be resealed once. And so this requires a lot of money. It's going to require both a design phase and then a construction phase. We're trying to get the money from the legislature. It's estimated at about $5 million, so it's not an easy thing.
Just for this?
For the rooftop.
Based on GMH Chief Planner William Condo's assessment of the current conditions, the total estimate for capital improvements is about $57 million. And that's not including the issues at Z-Wing, the oldest section of the hospital. Reporting for Guam's News Network, I'm Julius Santos.